Started so that those who have to leave can, maybe we can get done. I'll call the meeting to order. Roll call.
Okay. Clarence Campbell,
Here.
Richard Huber,
Here.
George Bousset.
Here.
Laura Negro. Dr. Keller.
Here.
Dr. Horny.
Here.
Joy Henriksen. Here. Elizabeth Franick.
Here.
Laura Cruz is absent. Okay.
Okay, approval of the agenda. Any need a motion to approve the agenda?
I'll make a motion to approve the agenda as presented.
I'll second. Motion made and seconded to approve the agenda. All in favor?
Aye.
Opposed?
Aye.
That was to approve, I assume.
Yeah.
Motion carries. Public comment pertinent to the agenda items, resolutions and ordinances on the agenda. Don't see any public here. Anybody online? Don't believe there is. So we'll move on to the approval of the minutes of the June 18th meeting.
I move to approve with attaching the comment that my name appeared way too many times, so I'm just gonna not.
I see that.
That was the motion, I guess.
Not the shut up part, just the agenda. The minutes.
Motion has been made and seconded, made by George Bousset, seconded by Dr. Keller to approve the minutes of the last meeting. All in favor?
Aye.
Aye.
Opposed? Motion carries. Approval of the public hearing and Human Services Board meeting minute. Sorry. Move on to 2025 year-to-date expenditures. Amber.
Okay, can you guys hear me?
Yep.
Yeah.
Great.
Year to date, what? I mean, was that through July or through June?
This is year to date through all expenses and revenues received through June 30th. So it's about halfway through the year. I also included last year's year to date where we were at this time, and it's very, very similar. So we're right on track. Not quite to that 50% when you look at the percentages along the way, but that's fairly normal. I think we'll be, as long as everything kind of keeps going how it's going, we should be, knock on wood, finishing close to our agenda if the next 6 months continue on. So I didn't have any red flags that I seen going through it, and things look like they're going pretty well so far. Did anybody have any questions on these expenditures?
Yeah, so under ADRC,
Yes.
so it says budget 1,000, variance 333. 300%.
So yeah, it's such a small number. I kind of just didn't even notice that. We the ins and outs, like as far as money that we got back and paid out, is going to fluctuate some. So I anticipate that'll change where we won't have as much out of levy when we get to that point at the end of the year. But
I just don't understand the number. How is 333 300% of 1,000? I don't.
Well, so I budgeted $333. In fact, I'll make sure that is correct. I'm wondering if something got mixed up in there, but and then we have $1,000 expenses, so that's why it's showing that we're 300% over. But I know that $1,000 levy mark is going to like that money will probably change some. We probably have more revenue coming that just hasn't come in yet.
Good.
We'll get our true number, in about spring of next year for 2025. But most of our stuff gets reimbursed, so I don't get too excited about that ADRC number. Any other questions?
If not, we can move on to the approval of the 2026 budget.
Yeah. So, not a whole lot of changes on this. I don't know if you guys got a chance to read the nice summary that, Terry made up to go with it, to go along with this, with detail. There isn't a lot of changes. The, few things I just wanted to point out, we are increasing our levy request some. I actually expected it to be more, with mainly being all of the, step increase for wages, but it's, didn't come out to be as much as I thought it would be in the end. And I think that was due to a couple of retirements, then, with the retirement wages, and then replacing with the, lower wages, what kind of helped us out there for part of it. And so we don't have a big increase, in our, general levy request. The, for CCS, you'll notice that they actually are requesting a little bit less money. It's $110, but they're no longer going to be offering the CSP program. And we did have some expenses that were 100% out of our pocket, out of the levy, because there was no income, no clients. So with that taken out, that didn't decrease about a couple $1,000, $2,500 a year that we potentially budgeted and spent each year. And then we did still are factoring in 97% reimbursement from them. And as I said in a previous meetings before, the last 5 years through 2023, we for sure were able to get reimbursed like 99.9%. So hopefully we get the 100% again. We just don't know it till about a full year after the year's done, when we go through the WIMCARE process. So I still budget at 97%, figuring a 3% levy expense on us because it's never 100% guaranteed. But we've been getting it, so that's been very reassuring. Child support, you can see in here, like Kelly and her team over there have been working hard. They had an increase in revenue, so that helped actually lower the request of what's needed from there. So that's looking really good. But other than that, those are just kind of like the few highlights I wanted to point out. Did anybody have any questions after reviewing this?
Yes. This is Elizabeth Franick. Can I ask a question or two?
Absolutely.
Just for people that might be listening in, or maybe in the future, if they look at the minutes or even listen to the recording, can you explain the program that was not being offered? And can you also explain if that was because there's no clients, or if that's something being cut because of lack of funding? And is there anything else that is going to be affecting the county residents as far as the SNAP program with food stamps or medical assistance? Thank you.
All great questions, Liz. So the program that we no longer are going to be certified for is the community support program. And that is because a couple of reasons. Historically, we only had the community support program. That was the only thing that was offered, and it was a 60-40 split generally. So the state would pay a portion. Well, it was supposed to be state match. Of course, they make the counties pay that. So we would pay 40%, get 60% from the feds. And then we could support people in the community who would elsewise be in an institution for mental health. So we got to keep people in their own community and give them really intensive services, so they didn't have to go to an institution far away. We have none close to us, so You know, that was a huge thing back before we had these programs. Then when the state expanded the CCS program, so the Comprehensive Community Services, that had been in place before, but it had also been a 60-40 split. And in the budget a few years ago, I believe it was 2014, in 2015, we got certified for CCS. And we did that because in the budget, the governor had approved 100% fully funding that program. So we have been working for 10 years to get that program really, really well tuned. That is a rehabilitative program where we do things side by side with people. They have a mental health diagnosis and or substance use disorder. So we kind of along the same lines as CSP, we provide supports to them so they can stay in our community. We get them the services they need. And our goal with that is to have them self-sufficient, independent, not need us anymore. So what we've found through the years, because we've been certified for CSP for the last 2 years, and we've had really nobody who needed that level because CCS can provide those services and is more proactive to teach the client skills. Instead of doing for, we do with and teach them so that they can be independent. So we haven't had anybody in that program. If there's a need, we can be certified again. We would just go through the whole process. But the state basically told us, you're not serving anybody. We're not going to continue to certify you when you haven't served people. If you need us again, knock on our door, we'll come and go through that process again. So that is why we let that program go. As I said, if we need it back, we can get it back. But there were, as Amber pointed out, there were costs there that we had to absorb because we had no clients. That's just the costs that go with the program, the certification, all the expenses, programs, the policies, everything that need to be updated on a regular basis. And so the decision was made. For now, we'll let it go, see how it works out. We haven't needed it. So hopefully CCS will continue to be appropriate for everybody and serve the folks that we need. Did I answer your question on that one, Liz?
Yes, thank you.
Okay. And as far as SNAP goes, so in this budget year, and I will say a little and then I will pass it off to our expert here. So most of the provisions in the big, beautiful bill, the omnibus reconciliation bill, don't go into effect until 2026 and later. So for this budget cycle, not much will happen. However, in October of 2026, so the services won't change for our clients, but the reimbursement that we get from the feds changes. So currently, for some of the costs that we have, we put in 50% and we draw down 50% as a match. So what they are changing in October of 2026 is we get to put in 75% and they'll match us 25%. So that will have a hit on us. We haven't been able to really project out quite what it will be, but the biggest county in our consortium is Wood County, and they projected, I believe, that they would be affected about 43,000, and they've got, I don't even know how many more clients than us. They have a huge population base compared to us. So ours should be minimal, and it would just be for 1 quarter in 2026. Those are just costs. We do have some reserves that we can go into. So we didn't include it in this budget because we've been very frugal and trying to save money, knowing the day like this would come. So we should be okay for 2026. And as far as services,
At this point in time, for SNAP anyway, I wouldn't expect any major changes yet. There's gonna be some changes regarding the ABOD, the able-bodied adult without dependence work requirement. But we're still waiting to see exactly how that's gonna end up falling, and what that's going to mean for our clients. The same thing involved with Medicaid. We're just basically waiting to see exactly how those policies are impacted. One of our focuses right now, if anybody's been reading the news or hearing a little bit about SNAP and how the big beautiful bill affects things. As a consortium, we've been very focused on reducing as much as possible our state error rate. Ours as a consortium is not very high at all. I think we're only about, our last one was between 4 and 5%. And the target number for the state is about 6. But collectively as a state, we're a little bit over that right now. So we've been very focused on trying to reduce those errors in order to reduce how much funding we're gonna have to put into the program. But as far as our participants in the programs, other than a few work requirement things, right now, they're not gonna see any big changes, but there will be some changes coming in the future. We just don't know exactly how that's going to appear and what that's going to look like yet.
Thank you so much.
George?
Just that, extension services are losing their food wise educators, right?
Mhm.
So SNAP loses that benefit of having people to educate people about how to use the food. I think you're losing about 4 people across the tier.
Yeah, there's definitely a lot of impacts with the outcome of that bill being approved. And there's gonna be, I mean, even for Medicaid, there's gonna be larger impacts than just people receiving services. There's going to be hospitals in rural areas that's gonna be impacted. There might even be, I know the last meeting we had mentioned, DHS had put out that public press release, just indicating that there would potentially be a change in how much services people receive, or could be an infrastructure change, or could be a tax increase, or a combination of all three. Just nobody has those solid answers yet, and I know everybody is very anxious to receive those answers. We just
Yeah.
don't have them yet.
Any other questions about next year's budget? Do we need a motion in a second to approve the budget and submit it to finance?
yes.
Well, I was not to talk, but I'll move to approve.
Motion by George, seconded by Dr. Keller to approve the 2026 budget proposal and submit it to the finance committee. All in favor signify by saying aye.
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 Opposed? Motion carries. Resolution in support of state investment for income maintenance administration.
So that is prettied up in the packet. And for those of you who aren't here, it is online now. Heather over at the courthouse did make it nice for this will be what, if you approve it to be forwarded to the
County board?
full county board. Shouldn't try to read and talk at the same time. Then this is what it would look like. So, based on what we were just talking about, this kind of outlines some of the things that we see as problematic. So the Wisconsin Counties Association had asked us to see if everybody's county board would want to do a resolution. So this is kind of what they had come up with. There are implications, not so much in 2026, but 2027 and 2028, when these all take effect, of how, all they did was shift the costs from the federal government to the state, and the state is shifting it to the counties. And so I can tell you that the Wisconsin Counties Association and the Wisconsin Human Services Association are going to push back to the state to say, you need to have some skin in the game as well. You can't just pass this on to the counties, because this will have detrimental effects on everybody. The workload is increasing. So, I guess there was a little bit of like, should you really have put in here that we're going to lose potentially some employees because our workload is going up? We really can't lose employees because we're going to have, instead of yearly reviews, they'll be every 6 months. We need to verify the work requirements that they're doing what they need to do. Verification is probably changing. So that is a strategy I'm sure the Wisconsin Counties Association and WICSA will be putting forward. And just as an aside, for example, when some changes affect most counties, like if there's changes in child welfare, child protective services, the state passes those right on to us. So if there's no extra money there, we don't get any extra money and we have to come up with it. And of course, costs go up every year. They didn't allocate us any more money in the federal state budget, none of that this year. But because of issues in Milwaukee County years past, the state of Wisconsin runs the child protective services in Milwaukee County, and state always funds those increases for them. So that's kind of, we're saying you need to have some impact for the other counties as well. So that will be something we'll work towards.
Any questions about that resolution? You would care to make a motion to approve and submit this to the full county board?
I'd like to make that,
Go ahead.
this Elizabeth Brannick. I can second it if you want to first it there. Sorry.
Okay, I'll make a motion to accept this resolution and pass it to the county board.
And Liz, you'll
And
second.
this Elizabeth Brannick, I'll second. Thank you.
Any further comments? Otherwise, all in favor?
Aye.
Aye.
Opposed? Motion carried. Next item is open discussion for input and comments to be passed along to the Ashland County Board Planning Committee with regard to the upcoming Ashland County Comprehensive Plan update.
I'll speak to that for a second. We just came out of a planning committee meeting. And it was discussed the need to put more into the comprehensive plan about health and human services. So Charlie Ortman has taken on the role of seeking to write a section related to that. He'll probably be in touch with you, Terry.
Okay.
And I pointed out that there's this excellent piece of background information that he could tap into. That's in the package today. So I think there's something in the minutes from the last meeting as well. So that'll be, you already have a lot of information that's by way of input, but he's be writing a special section about that.
Okay.
Dr. Horning.
Yeah, I guess I said this last meeting too, but I would like the sort of planning and the vision of the big county board to think about that Spark program and ways to keep that a sustainable program. And it definitely would speak to what Charlie's maybe talking about, wanting more from this committee. And so I understand it's not a small budget item, but I think in the big picture, the county is spending all that money on the jail and law enforcement and treatment for health problems, and that prevention piece with Spark feels like really good money spent. So I'd love to see that in part of the sort of planning for the future.
Thank you. Any other comments?
Yeah, there was a big discussion today also about recreation, family type recreation in the county facilities. This kind of relates to that. And then I also want to say from reading the minutes last night for our prior meeting, that was a really great job of writing up the minutes. Yeah, amazing, yeah. Just great, great news.
Anything else on the comprehensive plan? Then we'll move on to the public health update.
Hello, everyone.
Liz?
A few updates for public health. Our tourist rooming house and DNR well water testing season is starting to wind down. And with that, we are gearing up for flu season. So we already have clinics scheduled for private businesses in the month of October. And we are actively working on scheduling clinics for the in-school settings, as well as other various public locations. Flu vaccines this year will be $35 for what would be considered the regular dose, $85 for the high dose for individuals ages 65 and older. Other updates, we've recently completed our state water lab inspection. Everything went very well as far as that goes. Just a couple of small minor details as far as documentation. We already have corrective actions in place and are being implemented, so that all went very well. Exciting news that we have for an update. Ashland County has been awarded the Wisconsin Department of Justice State Crisis Intervention Program grant, or the SCIP grant. This is for the project period of September 1st, 2025 through September 30th of 2026. And our project is specifically related to hunter safety education as harm reduction. Funding will be utilized to support educational outreach activities throughout Ashland County, and we will contract with the North Wisconsin Rod and Gun Club to provide hunter safety education courses hosted at local participating school districts. Funding will cover the costs of training materials and supplies, class enrollment, and associated certification costs. The goal of hunters education is to train safe, responsible, and law-abiding hunters. Hunter safety education programs decrease hunting-related shooting incidents and other hunting injuries and emphasize safe and responsible firearm behavior. Suicide is the leading type of firearm death. Studies have indicated that firearm ownership is linked to an increased risk of suicide death. So our goal is providing lethal means safety training in a setting where firearm owners expect to hear safety messages about firearm use, such as the lethal means safety training is temporarily removing or limiting access to a specific method of suicide. So through this hunter safety education course, it provides a base for harm reduction, and our estimated contract allowance for this is just over $17,000. So we are very excited about this. We're waiting for the official paperwork to come through, and then we will get going on purchasing supplies, educational materials, and start to schedule classes. And then just another update for something else we've been asked to participate with. The Wisconsin Coalition Against Sexual Assault has asked us to join in a presentation on September 10th, which is titled Accessing Healthcare in Wisconsin. The basis of this presentation is understanding the reproductive healthcare landscape of Wisconsin can be confusing, especially if you are located in a more rural area. Clinics now are providing more comprehensive care and more trauma-informed care than ever before. So Ashland County Health and Human Services Public Health will be presenting with Planned Parenthood and Health First Network to provide a snippet of services available through Title X clinics, specifically in rural settings. And then I just wanted to share a quick measles update for you. There are currently 21 confirmed cases within the state of Wisconsin. Currently, all cases are located within Oconto County. There was a recent press release issued related to a known exposure via an out-of-state traveler that had been moving through Wisconsin. DHS is working with the affected counties to identify potential exposures. Of the 21 confirmed cases, all of them are unvaccinated. 62% are between the age of 5 and 17 years old, and so far one individual has been hospitalized. So we have regularly been sharing information with our school districts and working on planning and implementation as much as far as preparedness as we are able to, just to try to have all bases covered on the off chance that something should happen. So any questions on updates at all?
George?
Is there anything about COVID vaccinations this fall?
DHS continues to recommend COVID vaccinations for individuals 6 months of age and older. There may be differing recommendations from the newly appointed ACIP panel. So we are still navigating that front.
Is there any update of the vaccine itself?
I don't have any specific information regarding the vaccine itself at this time, no.
There's, I believe, 3 that will be commercially available on Moderna, Pfizer, and then Novavax, I believe.
Those are the 3 available, you're saying?
Mm-hmm.
I just didn't know whether there was a new version of vaccine this fall.
Like a combo one, like a COVID and or like a different strain.
A different strain, yeah.
Yeah. Not necessarily. Seems like it's the same variant that's circulating. Nothing substantial to change anything that I'm aware of in regards to COVID strain.
Thank you.
Any other questions for Liz? Okay, the next item is International Overdose Awareness Week. There's information in our packets.
Yep, so we do have information available in the packets. The Schwamigan Bay International Overdose Awareness Day Committee has been actively working on planning local events and different outreach campaigns. We do have 3 billboards up this year. 2 of them are on Highway 13, north and south directions, and then we have one on East Highway 2, which is actually the one that is pictured in the packet. And then I only had a couple of yard signs left over. I believe there were 4 of them. And so first come, first serve, whoever wants to grab them, you are more than welcome to please grab them. There are the little skewers included with them to post them in your yard if you so wish. So we have those going out through several different locations of our partners through the coalition. And then we have also partnered with Iron County, and actually Bayfield County is added into this partnership as well for a radio advertising campaign that will cover our local service area. I believe that is going to go for a minimum of 3 months regarding harm reduction and naloxone use, just kind of a public education campaign that we have going for that. So International Overdose Awareness Day is officially on the 31st, but we recognize, celebrate is the wrong word, recognize throughout the month of August, and most of the community outreach events are specifically scheduled around like within this week and then on the 31st. So
Dr. Horning and I could post those in our yard, but the only people that would see them would be the people working on Chapel Avenue.
Well, all the traffic that's not going down Chapel is coming down on MacArthur, so they're seeing them posted in my yard, so I got you covered.
Liz, this is Liz Franick. Are there any events scheduled for that day?
There are several events scheduled at the drop-in centers. I know Bad River, Red Cliff, and the Perk in town all had specific events, which I forgot to include the schedule of events in the update, and I don't remember what they were off the top of my head. I apologize for that.
Could a person just go online to see what events are coming up?
Yes, I believe the chamber actually had some information posted on them, and I'm doing a quick Facebook search here because I know there was information on there.
Do you have access to the email Shannon sent out? Because it had the dates of those 3 events, and I didn't bring my tablet with me.
So on Thursday, August 28th at 5 p.m. to 7 p.m., Bad River's having their International Overdose Awareness Day community event over at their harm reduction building on Maple, and that's easily found online.
And it looks like Red Cliff is having one on the 31st from 1 to 4 p.m. Food and beverages provided. And I don't have the date for the perk.
Thank you, though. Thank you.
Okay, well, move on. Next item is written materials. Any questions about any of the written materials, or any of the supervisors want to point out anything that we should pay attention to in those?
The only thing I'm gonna point out for the economic support update is that there was some type of numerical glitch for the July numbers from the last meeting. So this report has the updated numbers. It looked like our Medicaid numbers had dropped significantly, but that was incorrect.
And then just the thank you letter to the governor. We had all written letters to our representatives, and had anybody in the state of Wisconsin as of July 1st, before this veto, had a child placed at Lincoln Hills, it'd be over $900,000. And then the second year, it would have jumped to over $1 million for one child. So governor did some tricky work with his pen, and they're going to have to figure something out. But that's just ridiculous for one child to cost that much.
Yeah.
Any other questions or comments? Any board member updates or future agenda items? Otherwise, we'll move on to our second public comment period, limited to comprehensive plan discussion. I don't see any public wishing to speak.
Hard to get that public comment.
Yeah. With that, our next meeting date is November 19th at 4:15 p.m. here. We're going to get everybody out in time to go to their conferences or their orientation, or whatever you want to call it. Better make a motion to adjourn or what?
Motion to adjourn.
But this is Elizabeth Franick. So just like I said at the planning committee meeting, I'd like to publicly announce that we are all thinking about and praying for all the victims affected in Minneapolis at the school shooting. Unimaginable tragedy.
Motion has been made and seconded to adjourn. All in favor?
Aye.
Opposed? Motion carries.
No.
Yeah.
That's the wrong word.
No,